Good morning, everyone. Thank you so much for joining. We just have folks coming in from the waiting room, so we'll get started in just a minute. Good morning, everyone. Welcome to the start of the final day of the 2024 Global Health Landscape Symposium. During this plenary session, we'll explore how the 2024 US election outcome could impact America's role in global health policy and funding. Our expert panelists will discuss potential shifts in priorities such as disease prevention, pandemic preparedness, and health equity, and examine how changes in US leadership may influence global health partnerships and initiatives. Before we get started, allow me to introduce our panelists. Carmen Pan is a global health reporter for Politico, where she covers US global health policies, disease outbreaks that have the potential to spread, and the politics of global health. Prior to her current role, she spent 5 years covering health policy at Politico in Brussels, where she wrote about the access to pricey therapies for children with rare diseases, growing old with HIV, and Eastern Europe's healthcare systems. Abby Maxman is the president and CEO of Oxfam America, where she drives a vision of global justice and equality. With over 30 years in the field of international humanitarian and development policy and practice, Abby has been at the forefront of addressing complex global issues through an intersectional approach to humanitarian relief and development. Dr. Ahmed Agwal is Vice President of Global Health Strategy at the United Nations Foundation. Prior to joining the foundation, he served as Deputy Director General at Africa CDC, where he led program strategy and delivery. Previously, Dr. Agwal worked for nearly a decade with the WHO at both its headquarters and the regional office for Africa. And Gunjan Beda is Global Secretary and Executive Director for the Movement for Community-Led Development, a majority world-led network of networks with over 2,000 local organizations and their INGO allies committed to putting communities front and center in development. Her work includes creating collaborative and mutual partnerships, interrogating structural violence in existing systems, forms of knowledge, production, and publication, and consistently challenging existing spaces for partnership, capacity strengthening, and knowledge sharing to become more inclusive and more equitable. We'll now hear from each of our panelists, followed by a moderated Q&A, including questions from the audience. So please feel free to drop your questions in the chat as we go along, or raise your hand towards the latter part of the session. Carmen, thanks for opening the discussion. Over to you on how you think US foreign policy, and specifically development and global health policy, may change based on the 2024 election outcomes. Thanks so much.
Thank you, Ansley, and thank you so much for having me. Morning, everyone. I know many people here have heard these before. They're aware of what's coming. So I'm hoping I will tell you stuff that you didn't think about or you didn't expect. But if I don't, please ask questions. And based on what I hear in my reporting so far, I'll be happy to address them as much as I can. So just to state the obvious, the results of the US election will have a significant impact on global health and on foreign aid more generally. As we all know, the election of Donald Trump and the victory of Republicans in Congress is expected to sort of like, in some cases, according to some people, disrupt what we have been used to in terms of global health funding, policy, and norms. Donald Trump and many congressional Republicans are skeptical of multilateral organizations, including the World Health Organization. We are all very familiar with their America First policy, where they always want to make sure that the US gains from whatever policy it runs, whether domestically or abroad. So many people that I spoke to expect a much more transactional global health policy, and also they expect that the new administration will want to see very concrete results for some or most of the global health funding that is being spent abroad. So I will just touch on a few global health policies issues, which, based on my reporting, are expected to see a significant impact in the next 4 years. So first up, the World Health Organization and the pandemic agreement negotiations. As many of you probably remember very well, President Donald Trump decided to withdraw from the World Health Organization in his first term in 2020, blaming the World Health Organization for cowering to China at the beginning of the pandemic. But because the US law required a 1-year notice before the withdrawal became effective, that withdrawal never really happened because, as you all remember, Donald Trump was voted out of office. President Joe Biden came in and he withdrew the withdrawal, basically. So that never happened. Now, President Donald Trump will have full 4 years to decide whether he wants to withdraw from the World Health Organization. He has the time to make it effective. Of course, the question is whether he will do it. I have asked his team. They have not addressed that question directly. Many people do expect that he will do it this time. He will see it through. And if that happens, of course, the World Health Organization will lose one of its top government donors. But there will be also impacts for the US, like the US would be locked out of the process by which health authorities around the world decide every year which strain of the flu shot of that year should focus on. And this is just one of the many consequences. Many people worry that many of the collaborations that exist between US institutions like the CDC, like the National Institutes of Health, and the World Health Organization will stop, and this will have a massive impact on people's health all around the world. The pandemic agreement negotiations, many people hope that there will be a session before the end of the year, that negotiators in Geneva would have had enough agreement to come together and see through the adoption of the pandemic agreement. That hasn't happened. So now it is well expected that President Donald Trump will withdraw the US from those negotiations and not want to be part of sort of like any agreement that comes through. Some of the discussions, some of the things being negotiated in this agreement, such as the pathogen benefit and sharing system, is at odds with the America First policy. And I'm thinking particularly about the plan to share a percentage of the vaccines, drug tests that would be developed with pathogen information that a country would share. So many people that I've spoken with in DC, former HHS officials who were there during the first Trump administration, don't expect that the US will want to have anything to do with this under a Trump administration and under a Republican-controlled Congress. And it's not just President-elect Donald Trump. There are many Republicans in Congress, and all of the current Republican senators who have been opposed to the agreement. They have required that at least it goes through the Senate. And many have said that they feel that it would give up more sovereignty from the US to the WHO, give WHO more power. Of course, the WHO and many people involved in the negotiations have said that's not the case. This is a country-led process. But as far as I can tell, that hasn't led to any change in the policy and in the view of many Republicans in Congress. The next thing I wanted to touch on is the sexual and reproductive rights of women and girls around the world. As we know, all Republican presidents since mid-1980s have instated the so-called Mexico City policy, which bans foreign organizations that receive US health funding from providing or promoting abortion or abortion rights. President Donald Trump, in his first term, expanded this policy where it used to cover maternal health funding. It expanded to cover almost all global health funding. Now, the next question is not whether he would reinstate that. He is widely expected to do so, but whether we would see yet another expansion of this policy. Like, for example, domestic organizations would be under the same restrictions now that the federal right of abortion is not guaranteed anymore in the US. Or if it will cover organizations getting any sort of US foreign funding, not just health funding. And because I'm talking about global health funding, let's spend a minute on that. Many organizations, as you all know, and probably are very involved in, are seeking to replenish their coffers next year to cover their operations for the next few years. That includes Gavi, the Vaccine Alliance, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and the Pandemic Fund, which is a fairly new creation hosted by the World Bank. Gavi and the Global Fund have typically enjoyed bipartisan support in Congress, and they have seen their replenishment supported by the US throughout Republican or Democratic administrations. The Trump administration did try to reduce some of that funding in their first term, or tried to reduce the percentage that the US gives to the Global Fund from a third to a quarter. But because of the bipartisan support that I was talking about, Congress opposed it, so that didn't happen. Many people that I've spoken to who are very knowledgeable of this process said that they expect that dynamic to continue, at least in the next 2 years. But some have raised a question that I think we still need to wait and see the answer to, which is if Robert Kennedy Jr., who's been tapped by President Trump to be the next HHS secretary and who's widely known for his vaccine skepticism, if he is confirmed as HHS secretary, will he try to influence the administration's decision on global health funding for vaccines, for example? Will it affect Gavi's funding from the US in any way? So that is something that we will have to wait and see how it plays out. And the final point that I wanted to touch on is PEPFAR. As you all know, for the first time ever, the program only was reauthorized for 1 year instead of 5 last year. And that was because some members of Congress were concerned that some of the money was going to organizations that were supporting abortion rights, promoting abortion, or providing abortion with other funding. PEPFAR officials, beneficiaries, implementers have said that never happens because it's against US law. Yet the program did stumble in its reauthorization. It is coming up for reauthorization again this March. And here, opinions of people I've spoken to are split. Some expect that a Republican-controlled Congress and a Republican White House would reauthorize it potentially for 5 years, because if the Mexico City policy is in place, like I was mentioning before, there will be less concern, even though many say it's unfunded, that organizations supporting, promoting abortion will get PEPFAR funding. But I've also heard voices that said, PEPFAR officials, people working with the program, in the program, would have to really come and show exactly the results, which obviously PEPFAR has a lot to show. And also what the plan is, how much and when can countries that continue to benefit from PEPFAR will be able to take over more or most of the program funding. Obviously, this is the sustainability agenda that we've been hearing about for a while. So many expect that sort of like people working with PEPFAR, supporting PEPFAR, would have to continue making the case of why PEPFAR funding continues to be important, and also how countries benefiting from it have ownership, and how much of a stake they have in the game. So this is not sort of like, as someone said, an endless program from the US where the countries benefiting from it are not contributing sort of like proportionally. So I'll stop here, and then we'll look forward to your questions when the time comes.
Thank you so much, Carmen. I think you did a great job at pointing out a lot of the different major implications that this election is going to have on global health policy and funding. Abby, can you tell us more about how global shifts due to the 2024 US election might impact global health and disease prevention programs worldwide?
Yeah, thanks so much, Ansley. Good morning, everybody. And really thanks to everybody at the Global Health Council for convening us, because gatherings like these are so crucial for not just navigating times of uncertainty, but galvanizing us for action. And, following Carmen, who I'm just going to echo a lot of what she already said, but hopefully move to what we can do, because one thing that is different this time around is we've seen it. We've watched a whole Trump administration. We've heard what the intentions are. We've seen the trends, and we've read Project 2025. So let me just talk about Oxfam. We are a global humanitarian and development organization and network operating in over 80 countries around the world, providing life-saving assistance and tackling inequality and poverty. And we are like everybody, with our partners and allies watching and preparing. And I hope we can have some preparatory actions even coming out of today. Because, as the Trump administration comes into office next year, we know the world is watching closely, especially our peers and partners across the global south. And now is the time to listen, learn, and fight alongside them. And I want to start by saying that the US did make, we all know, significant contributions to global health. It's Carmen already acknowledged that. PEPFAR alone is credited with saving 25 million lives. However, the influence of private finance is shaping the global health landscape, often exacerbating inequality. I'm going to touch on that in a little bit. I want to address three main issues. First, as Carmen already touched on, reproductive rights. We need to brace ourselves for a global attack on gender equality. The greatest expansion in history of the global gag rule happened under the previous Trump administration and had severe impacts on reproductive health, closing programs, silencing partners, and health experts expect the gag rule, as Carmen already said, to be reinstated in an expanded form, potentially covering all U.S. foreign assistance, including humanitarian aid. Now, this scenario is alarming for women's rights and gender justice organizations around the world. Family planning services are crucial for global health and achievement of the SDGs, and a study of the health consequences of the Mexico City policy estimated that the previous Trump administration's anti-abortion policy led to 108,000 maternal and child deaths and 360,000 people contracting HIV/AIDS. Call to action. We must build public pressure and continue fighting against policies that dictate women's choices globally. Second big area, Carmen already touched on it, HIV/AIDS, access to medicines. We need to guard against potential funding cuts, especially, as Carmen noted, for Gavi and the Global Fund to fight AIDS, TB, and malaria. And PEPFAR, which, as already acknowledged, received bipartisan backing, it supports about 3/4 of all people living with HIV in PEPFAR countries. So despite significant progress, 1/4 of the 40 million people living with HIV today do not have access to life-saving treatment. So another call to action, we must continue to fight for this funding, to protect it, to do the bipartisan cross the aisle work to address this funding issue and address the global governance of medicines. And pivoting for a second to the pandemic, we have a lot of learnings. It highlighted the need for global South countries to fight and to have the rights and technologies to manufacture their own vaccines and medicines. And despite our efforts collectively, big pharma resisted and eventually watered down multilateral efforts that were led by South Africa and global South countries and movements to produce life-saving vaccines. Now, data shows how the failure to equitably share vaccines contributed to as many as 1.3 million excess deaths worldwide. In short, this means going against the interests of big pharma, who would prefer to monopolize them and control supply. And pandemic preparedness and learning from what we have all experienced is vital and under threat in this new administration. So we must support these efforts underway to invest in global South local manufacturing, advocate for the US to support these initiatives in the new administration, rather than extending pharma monopolies. And that leads me to my final point. The global health model itself has baked in inequality. In the US, private equity's role in healthcare has really hollowed out care homes, increased prices for patients, lowered quality of healthcare, and increased mortality rates. This model of hyper-financialization is now affecting global health, with US private equity and institutions like the World Bank's IFC extracting profits. Now, Oxfam has a report called Sick Development that highlights these issues, and we must hold private actors accountable for their harmful behavior, especially when leveraged with taxpayer money, especially in the context of the new administration. We must advocate for a vision of public health that centers on public investments for publicly delivered healthcare for all. This vision challenges private interests that favor big pharma, private equity, and monopolies over access to medicines and healthcare providers. And it is a vision that aims to reverse the rise of catastrophic healthcare bills, centering equity in democratic global governance. There are movements we can take action now and have bodies like WHO, Carmen spoke to this, that are empowered, in which people in governments, not powerful private actors, call the shots. Now, the US has a big role in that. We know it, but there's everyone else too that can come together at this story, at this moment. And it's a story that can center equity and break with discrimination. So this is truly a moment to resist harm, to act together, and create a powerful new story for public health. Thanks so much. Look forward to the discussion.
Thank you so much, Abby. Appreciate you bringing up the issues of sexual and reproductive health and rights and gender equality, and also talking about moving us to action as well. I think that's really important. So thank you. Dr. Oswell, could you tell us about the implications of the election for US leadership, collaboration, and contributions in pandemic preparedness and response initiatives, and particularly in the multilateral space? I know Abby and Carmen have touched on this a bit too, but hoping you can dig in a bit more. Thanks so much.
No, thanks, Ansley, and good morning, good evening, wherever it is that we are joining from. Very important topic for discussion today. Bring greetings from the UN Foundation. On the issue of pandemic preparedness and response, there are three things that we need to be keeping an eye on in the coming months. One, of course, is the negotiation around the pandemic accord itself. Very important for PPPR, for pandemic preparedness and response. A second is the outcome of the UN General Assembly's high-level meeting last year, which was on pandemic prevention, preparedness, and response. And there are very key proposals in there that we need to keep an eye on as we continue to improve the way in which we prepare for and respond to especially large outbreaks. The third is financing for global health. These three things, I think, are key as we continue this conversation around what happens when we have the new leadership in the US at the moment. And let me start with the reality that when you look at pandemics, epidemics, outbreaks, they start and end at the community level. If we have strong community level action, then we are most probably going to succeed faster than if we don't have. But at the global level, the community is the country. And these large outbreaks, pandemics, will start at a country and then spread to others, depending on how we respond to them. This means that our ability to come together and address the challenge at source, whether it is at a particular community, it's in a particular country, then the rest of the world becomes better protected. And in light of this, we have seen over many decades, the US as a country has invested significantly in pandemic preparedness and response through many different agencies and even bilateral arrangements. Now, this investment is important because it does contribute significantly to the global preparedness. And so the way I see it is the US government needs to keep and protect that investment so that it continues to deliver the original vision that that investment actually had. So very key that as the new administration takes office, I'm sure they're fully aware of where the investments are and that the need to protect them is clear. And the need to continue supporting so that it delivers on a global sort of preparedness and therefore safety wherever it is that an outbreak may come. Secondly is when you look at the current arrangement around pandemic preparedness and response, many times it is reactive. We wait for something to happen and then we respond to it. Yet, there is a lot of value in doing the research that is required to ensure that we have the tools and we have the infrastructure that is needed to respond quickly. Many times, the research on these tools is government funded, particularly here in the US. And that investment comes into play, like happened during COVID-19 with the new platforms that we used for vaccines. And if that investment continues in the basic research that is required to develop new tools, then the US is safer, the world is safer, and we get our pandemic preparedness and response being at a much better state. And of course, we therefore really encourage that investment is not only protected, but it continues to be supported. Finally, is to look at where do we find those platforms, those fora for different countries working as one big global village to come together and discuss, agree, and then implement important strategies for pandemic preparedness and response. The UN system, through its various agencies for global health, being mainly WHO, but of course others contribute: UNICEF, World Food Programme, UNHCR, all contribute in their own ways. That platform, the global platform that the UN system has been designed to provide, also needs to be protected, because this is where the globe comes together. This is where all the countries can be able to gather and discuss, debate, agree on one way of doing things that keeps everybody protected. That UN system, the US government has been very key in supporting it, and also needs to be protected, and support to also be given to the UN system to continue doing the very important work that they are doing. So from my side, the level of investment that the US government has already gone into, as far as global health is concerned, the level of leadership that the US government has built over the decades, and the level of expectation that is there going forward really requires any new administration to come in and ensure that we don't have gaps, because nature abhors a vacuum. Whenever there is a gap, either a virus jumps into the space, or we get a lot of suffering across the world. So my encouragement to the incoming administration is protect the investment, target pandemic preparedness and response especially, and deliver on the leadership that the world has come to see and value of the US government. Thank you.
Thank you so much, Dr. Agwal, and particularly for focusing on the UN system and WHO and its importance to the whole system at large. Gunjan, could you talk about how changes in the US and global political leadership might affect our desire to address global health inequities?
Sure. I mean, how will an administration that has said very clearly that it is not committed to global health equity impact global health equity is an important question, I guess. I mean, we've all heard of the possible consequences of what could happen to participation in multilateral institutions, to, funding for programs on pandemic preparedness, to sexual and reproductive health rights, and all of that. So I'm going to take this much more from the perspective of where I sit, which is the impact on people, communities, and civil society. Because the Movement for Community-Led Development, we are a consortium of local civil society organizations and NGOs, right? So I come from India, and I can tell you one of the key challenges in addressing health inequities, right, in countries like ours, is the sheer fragmentation of the health systems. They are so disintegrated that it is a huge challenge when it comes to responding to and addressing health inequities, because that fragmentation allows the most vulnerable to actually fall through those cracks and the gaps. And what policies like the Global Gag Rule and others do is not just have direct implications on funding for programs for sexual and reproductive health rights, for instance, they actually lead to a fragmentation of the health systems in countries around the world. And they do this because organizations are forced to begin to decouple, right, different initiatives so that they can continue to provide at least some of the services which the most vulnerable people need. So that has huge implications on communities and on people and on civil society organizations and how they function, because we all know that we need to move towards integration, but we are now being forced to actually move apart and move towards fragmented systems just so that we are able to retain at least some of the work and some of the services which are needed by communities and people. So I think that's something very important that we do need to keep in mind when we think about what are the implications of this. The other thing, I think, there's been a lot of talk about pandemic preparedness, and communities we know are the first responders in any crisis. I will say the one thing which to me provides a little bit of a glimmer of hope is the support towards localization or locally led development that we do see or have heard a willingness for in this new administration. And that is support for local organizations, not from the rights perspective or the equity perspective, but because it's more efficient or perhaps more sustainable, right? But there is that push, and that has direct implications for communities. But what we do need to remember is that we've talked about multilateral institutions, and we all know multilateral institutions are flawed, right? They have major challenges. There are huge movements to reform them. Nobody is debating that. But as Dr. Ogwell said, as others before me just said, they are also the forums where we can come together for global decision making, where we can address some of these challenges commonly, right, together. So moving away from multilateral institutions, we saw what happened with WHO, the UNFPA, right? Contraceptive access in 173 countries is at stake. The most vulnerable communities in these countries are at stake, right? And then let's move to, what happens to sexual minorities and their rights with the current agenda. And finally, the climate piece, which I think we haven't touched upon, but is so important because we all know the links between climate and global health. And we also know that it is the majority world countries and other countries who have not actually been the responsible for climate change that are facing the biggest challenges to do with climate change, right? So there are all of these implications which will come into play for communities who will every day be bearing the brunt of more and more disasters and will have access to less and less funding. Now, what does it mean for us and our desire was your question. I wanted to lay out some of this to actually move to that. I think what it means for all of us, right, is something that we heard from Abby, we heard from Dr. Ogwell, we heard from Carmen, is a call for action, is actually recognizing our power in these situations, because the reality is that there has been one administration, and this time we know what to expect in many ways. I think the last time was the first time of the Trump administration. This time we do know what to expect. And so we actually have an opportunity to come together and to begin to plan around what is it that we should be doing together in this. Because they're going to move us towards, the new administration is going to move us towards fragmentation. And our job is to actually see that we stay together, because solidarity is the one thing that will get us through all of this, right? So I think in terms of our desire, the one thing I will say, and this will be my final point, is that it's very interesting when things like history is full of very tough moments and regimes which have challenged human rights and rights of different groups of people, right? And we have borne a very heavy cost of it, yes, but we've also come through it. And we have come through it because these are the times which encourage all of us and which make us realize the value of these very hard-won rights, which we become complacent about normally. And they actually force us to rethink our complacency and to mobilize for action. And so I think this does, in that sense, provide us with both an opportunity as well as a responsibility to mobilize in solidarity, putting aside differences that we have been tackling as a sector for so long, and which will continue to be there, but recognizing that right now so much is at stake that we can't afford to be divided. And I think this provides us a real moment of opportunity to galvanize and to do that.
Thank you so much, Gunjan. I know there were a lot of challenges that you pointed out, but I really appreciate you pointing out the glimmer of hope with localization as well. Thank you to Carmen, Abby, Dr. Ogwell, and Gunjan for setting the stage so well and really exploring how the outcomes of the elections could impact America's role in global health policy and funding in just the global health landscape more generally. Now that we have a bit more of a lay of the land, and I think all of our speakers were getting to this, it's really important to ask, so now what? What does this mean for the future? So this next question is open to all of you. Please feel free to jump in. How can global health advocates prepare for these shifts that we've been talking about this morning that may affect global health policy and financing?
I
Can jump in there. I think two things are important. One is all advocates need to find space to engage the new administration in advance and make the case for what has worked and what looks like it will work in the coming months and years. That direct engagement gives us the opportunity to be part of the building of the strategy of the new administration. This is one thing. Second is the world has a big opportunity now to also start re-examining how we fund our different global health initiatives. Is there opportunity for emerging institutions, markets, philanthropies, private sector? Are there other ways of optimizing the current funding and financing that we have that is addressing global health issues? That optimization and introducing efficiencies is going to release more resources, even as we continue to engage with the new administration to ensure that global health is well supported. This, I think, are the two things that I wanted to share in relation to what next. Thanks, Ansley.
One advice that I heard from someone who has worked in the first Trump administration was, telling advocates to, show the results for their work, for the funding that they have received, and show why that is good for the United States. How does it benefit? One thing that this person said, for example, was, how does this help us in the fight with China in African countries? People might not like that approach, that confrontational approach. But according to this former Trump administration official, this is one strategy, to present your work and to sort of like continue getting support for your work with, a future Trump administration.
And if I may, Ansley, it's really building on where Gunjan led where we left off at the end of her remarks about that solidarity, coming together, cooperation, strength, and unity. Now is a time for us to come together. The coordination, the cooperation, the ensuring coherence around how we work to really leverage us and the movements that we need, and the voices of the Global South and the Global North coming together. And to Dr. Ogwell's point about the administration and getting in front of that, but also members of Congress, because as all previous panelists pointed out, we know that there has been bipartisan support, that there is that understanding and can be, if we can make the headway and learn from the past to that it's a false choice that US health versus global health is somehow separate. We are highly interconnected, and there are many people, members of Congress and the incoming Congress, who know that and understand that. And how do we make sure we're working, across the aisle so that we can at least protect and hopefully maintain progress. But I think there's going to be a lot of defense and protection to preserve as our main mode at the moment.
And just a couple of very quick points to that. I think, again, I'll come to it from a little more granular perspective, but There's certain things like we do need to come together. The solidarity point has already been made, and the point of advocacy and finding the champions and trying to make a case, that's already been made. But I think there are a couple of other things also that we can do, and we saw this happen in the last Trump administration to some effect, right? We saw organized countries coming together, and the She Decides Fund, which was set up immediately after this happened, so that where countries, the Nordic countries and some others who were really concerned about the funding cuts to reproductive and sexual health rights and what it would mean, pooled together this funding as an immediate response. So we do have that opportunity. Again, we are in a different scenario. We know that the countries, many of them have also seen shifts in policies and administration since then. But there is an opportunity to galvanize, and there is actually a very live and not so distant example of us having done that. And now more than ever, when we have philanthropists, when we have McKinsey Scott, when we have a Melinda Gates coming and stepping in, if we can strategize, there could be a way to actually continue the work, the very important work that is happening. And the second very smaller point, but I think super important, is that there is a lot of confusion and chaos among civil society organizations in the majority world. I think even in the US and other parts of the country, world, but particularly in the majority world, of what the implications of the global gag rule are. And so what we did see happening in the past repeatedly is that services which could have been provided or which were actually not affected or covered by the global gag rule were also not being provided just because people wanted to be a little safer and they were not sure. And there was so much of confusion and misinformation. And I think this is something which is actually much simpler, but very doable, is for us as a civil society, people who have more access to information, to try and bridge that information gap so that the impact, we heard about the chill affected score, where the impact was much more than what it should have been with the gag rule, just because of this confusion, lack of clarity on what is covered. So can we actually prevent that from happening?
Thank you all so much. I think we've talked about a lot about how we might prepare, protect, maintain progress. Which leads me to my next question is, how do we ensure continuity of these critical global health programs that we've been talking about this morning, like PEPFAR and so many other US global health programs? And what's your advice to advocates on this call for how to do that?
I mean, please, Dr.
Yeah, no, tough question. But I think Carmen touched on that. Investment by anybody, including you and me, is always based on where we see value for money. And all these initiatives and the agencies out of the US really have been doing some fantastic work, and we need to put on the table the evidence of that work so that the investment can be able to continue. Many times we focus on where there is differences, where there's friction and conflict, and then we forget to talk about where there's actually good work that there's bipartisan support for. In my view, that's where we need to start. The safe areas to start discussing and then show the evidence. And then we progress to the areas where we disagree a bit. And we also show evidence there. And we see how we can be able to ensure that investment continues. So for me, the initiatives, the agencies need to provide that evidence to Congress, need to provide that evidence to the executive, need to provide that evidence to Americans in general, and the world will be able to see where the investment is making progress. And we make a case to continue that investment so that that progress is not lost.
I think Abby, if I may come. Oh, Abby,
Yeah, no, please go ahead and then I'll come in.
I was going to take off something that you had also said, in addition to what Dr. Ogwell said and Carmen said earlier, right? Which is, we need to also remember that the administration is not uniform on a lot. it's not like the incoming administration has one stand on all of these issues. There are champions within this administration and advocates and people who do believe in women's rights, who do believe in reproductive health rights, who do believe in, pandemic preparedness. And part of the strategy is also to find these champions and advocates and work with them, providing the evidence, but also making the case, but also using their influence and their voice in this administration. Because it's never, it's never a uniformity. It's not homogeneous, right? And I think there is a window of opportunity in there.
Yeah, and if I may follow on, but I'll take a different direction too, and I agree, +1 to all that's been said. But one of the issues we don't really talk enough about is the ability to connect our work in the pursuit of public health, of how we ensured low-income countries and have the financing they need. And if you look at the system, we know that 39 out of 67 low-income countries and about 20 middle-income countries are struggling to pay their debt. And so debt burden, we can come at it, and as Oxfam, we do this, of looking at the kind of broader ecosystem. Low-income countries spend nearly 40% of their annual budgets on debt service, over 60% more than on education, health, and social protection. Now, if we take a systems approach, I continue to, we see money existing and where it is going, it's follow the money. And we need to make sure we're maximizing resourcing and the investments that the panelists have all noted. And how we can do that is making sure we also look at some of these macro structural issues to make sure that countries are able to invest domestically in public health and the public health systems.
Thank you all for answering that tough question. I think we have a few questions in the chat, so I'm going to turn to those. First off, which I think is a really good one that we haven't touched on yet, is how can we best support the career staffers in the federal government working on global health, since they may face a real crisis environment in violation of their values? And we also know from reading Project 2025 that there are potential plans to sort of restructure federal agencies. So wondering if any of you wanted to tackle that question in particular, and then we have another one in the chat specifically for Carmen.
I can try to address the first one too, Ansley. So,
Sure.
Like I don't have the answer. I usually have the questions, but not the answer. People that I've spoke to that work on global health issues at different agencies are sort of like in a wait and see approach. I think for many of them, it matters a lot who gets nominated and, eventually confirmed to lead their respective agency and their respective offices. It's not all doom and gloom. Many people have said that they felt like at times they did better work under certain Republican administration and under Democrats. What I hear a lot is, let's wait and see. Let's see who's gonna lead us and what that person's values and experiences, and then we can make decisions. There is obviously, the Department of Government Efficiency that is being touted a lot. And yesterday, the two leaders, Elon Musk and Vivek Ramaswamy, published an op-ed in the Wall Street Journal where they kind of laid out their vision and what they want to do. But many of those intentions will come down to being able to show results of your work, which sometimes in a big bureaucracy like the US government can be challenging. But I also expect a lot of legal challenges to many of the things that they are attempting to do. So I think it's not all lost. I do think that people will probably struggle in some cases, and they will make the best decisions for themselves. But yeah, it doesn't feel right now, just speaking to people inside the agency, that it's all doom and gloom, at least for now.
That's good to hear. Thanks so much, Carmen. Is there anyone else that wants to come in on that question, or should we shift to our next question in the chat and then to Ashley, who has her hand up?
Maybe I can take one aspect, and that is
Sure.
there's an expectation generally on issues around budget, and all activities, actions, plans will rely on budget. I want to believe that in the next budget cycle, the budget will not be exactly the same. There may be some adjustments in budget, both for the executive and what Congress will pass or the Hill will pass. So until we have clarity of what's available in terms of budget, and again, I agree with Carmen, who has been nominated and confirmed to the different positions, the detailed play may be difficult to predict at the moment, and so advice will also be off if you don't see the actual detailed plan that the administration will come up with. But on issues around values, it becomes a very personal thing, and it may be difficult to offer advice in a general way. But budget, who has been nominated to head which agencies and which offices, and the detailed plan that the new administration will have will give us much better responses, if you want, and planning on the side of the civil society. Thanks.
Thank you so much, Dr. Ogwell. With that, Carmen, maybe you can answer this next question in the chat from Emily. She's saying that you mentioned WHO withdrawal has not come up directly in your conversations with the Trump transition team. Are there any global health issues or planned policy decisions that have risen to the forefront? Where do their interests seem to be focused when it comes to global health and development?
Yes, I wish I could tell Emily that they have given me any areas where they're interested in or particularly interested in. So no, so far, they're not really going into policy details. Someone suggested that they haven't thought that far as, how much money they would continue to pledge to, or they would plan to pledge to organizations like Gavi and the Global Fund, and that's like not their sort of like top priorities in the, beginning of the transition period. So no, I haven't heard anything specifically from the transition team so far in terms of, their focus on global health policy and development.
Thanks for that great question, Emily, and sorry, Carmen, that they haven't told you anything just yet. Wishing you had more answers there, I'm sure.
As soon as I have them, they'll be out.
We really appreciate that. Ashley, thanks so much for your patience. If you wouldn't mind just introducing yourself and then asking your question.
Hi, thank you. And thank you for this fantastic discussion. I'm Ashley Arabasadi, the Director of Humanitarian and Global Health Policy at the International Medical Corps, which is a disaster and humanitarian response organization. So I think you can see where my next question might be going. Beyond the Project 2025 lays out a plan to reduce or eliminate disaster and humanitarian funding, specifically MRA and IDA funding. What advice do you have for emergency response organizations where results like lives saved or wounds treated or health kits dispensed may not resonate with the America First focus or directly how it directly impacts or benefits the US? Thank you.
I'll start. I don't have the answer, Ashley, and I know we work in common cause on this, but I think there is something about dispelling this false choice that helping people in another country somehow does not affect people in the US, our common humanity. And I know that sounds lofty and idealistic, but as Dr. Ogwell talked about as well, the pandemics and viruses don't know no bounds. And I think you said, they abhor vacuums and respond to them. And so I think there is something, even at the humanitarian, or not even, including the response and preparedness level, that what do we all do to come together to inform and educate the US public? People want credible evidence-based information, even though it's hard to see that sometimes in this age of I think disinformation and disinformation. But we have an opportunity and a responsibility to tell real stories, the human stories, and people at their core, I believe, despite, some of the nasty rhetoric we've been hearing, are kind, compassionate, and caring. And so if we can continue to engage with our constituencies, come together, and ensure that we know that what happens in the U.S. has a huge impact on what happens elsewhere. And we can tell those human stories and come together to look at creative ways, both in the political sphere with our members of Congress, but also with the community, with the individuals who support organizations like ours. Again, I know that sounds a little like a dreamy answer, but I think it is part of what we have an obligation and an opportunity to keep doing.
Thank you so much, Abby. Carmen, did you want to come in on that as well?
One thing that I heard, and it's, it might sound superficial, but I'm just relaying what I'm hearing from people who have been closer to the power centers that are returning than me, is that, you kind of have to think about the things that make the political leaders look good, not sending people to a disaster somewhere from a country like the United States, which has been at the forefront of so many of these things in the past, could look really bad. On the future president and other political leaders. Flattery works. So, people being grateful, leaders of certain countries or certain places being grateful for their support that they receive, is usually well received and can move things. So that's all I can say. That could be a potential strategy going in the future.
Thank you so much, Carmen. We just have a few minutes left here, and thanks for everyone who dropped questions in the chat or raised your hand. I guess we'll end with this sort of closing question. I know it will be a tough one to answer, but would just love to get your perspective on what the future of global health leadership looks like. And I think interpret this as you will, short term, long term. But would love to hear from each of you in the closing minutes on what you think the future of global health leadership is.
I can start quickly. Again, something that I heard people say, which I found very interesting, is that this moment of potential uncertainty as disruptions are also a good opportunity for organizations and people working in this field and obviously other fields to kind of like look at what they're doing and see whether the status quo also needs changing. Maybe under, a different administration, things would have felt like a business as usual. So things would have continued the same. But because we are facing as a society a moment of disruption, if you think at anything from artificial intelligence to sort of like all the conflicts that we're facing around the world, the challenges that we're facing, someone was saying that this is a good opportunity, a good moment for organizations, people working global health to take a good look at what they're doing and see whether there's a better way to do it, there's a new way to do it. One of the examples that I heard is whether, and I know people working close to this organization or in this organization have strong opinions about, but, whether it's, the Global Fund and Gavi, for example, should merge. They're in the same building. They obviously have similar goals, but they work on slightly different things. So I think these going forward, I think from the actual organizations and people leading, global health action around the world, could be, could be a proof of leadership. Like, what are we doing that could be done better? Can we do things differently? And how sort of like can we adapt to the times that we're living in, the funding environment, and sort of like the new global order environment, if we want to think about it that way.
Please jump in, Abby.
Oh, good.
Susan.
We keep. I'll be quick. Well, I love the question because what does global health leadership look like? It looks like us. It looks like movements. It looks like a vibrant, active civil society. It is local. It is global. We've learned in the pandemic that, first responders everywhere are local, they're in the home, they're living our values. We're taking a longer view. This is a marathon because I think we are going, this is not a business as usual administration we're coming into. We can say it, you know, oh, well, we've been through, and we have, and we will, but it's going to be hard. And so remember that leadership sits everywhere. There will be vacuums, there will those who come in, and we want them, those who fill those vacuums to be filling them for good, and a vibrant, strong civil society and that holds private sector and government accountable for their duty bearers, and to be responsible and do the right thing is really part of that. So global health leadership in times like this really looks like us. Thank you.
Actually, I was going to say exactly that.
Oh, good
I
job.
don't
I should
think
have
I
let you
need
go
to take
first.
up more time. But yes, it really depends on us. And it depends on, are we able to come together? Are we able to mobilize and galvanize and stand in solidarity? And are we able to think beyond our immediate agendas and our immediate everyday concerns and take a longer term systems view and take a view which goes beyond survival mode? Because one of the things that move, moments like this tend to put us in survival mode, which is understandable, but which is also what makes it really, really difficult to handle and tackle moments like this. So are we able to, move from that survival mode to a longer term systems mode and strategy mode and do it together would determine it.
Yeah, and it's nice to come after everybody has spoken, because then you can just say thank you to everyone. But let me add one point. And there is nothing, we say in health security, we say never waste an emergency. When an emergency comes, milk it and squeeze every ounce of energy you can get out of it. And COVID was a moment in global health when we needed to reset a lot of things. And those lessons, when carried forward, will help in this, again, another transition where there is possibility of a different angle to the US and new administration approaching global health issues. But those moments, when they come, we best use them to the benefit of global health. And I fully agree that disruption is the time when you get innovative. I will give an example of the Lusaka Agenda, the Future of Global Health Initiatives. Can we optimize these resources? Can we optimize delivery of those resources? Can we optimize the sources of the funding that we have and make them more domestic, even as we ensure that what is coming from outside of a country is utilized in an efficient way? This is the time for optimization, is the way I see it. If global health does not reinvent and optimize the resources that are coming into the space, then we will be having some really, really difficult months and years ahead. But if global health optimizes those resources, then things are going to be a lot less challenging from what we are predicting where we are now. Thanks.
Thank you so much to each of our panelists. You have been so generous with your time and your thought in trying to answer these really tough questions that so many global health advocates are grappling with at this time. So thank you so much for this session. I know we're a few minutes over, so happy to release everyone to the next Global Health Landscape Symposium session. Please stay with us if you're able to, and thank you for your kind attention this morning. Have a great day, everybody.
Thank you.
Thank you.